The patient with disturbed cerebral circulation has problems with degglutination. That has to do with what? Swallowing, right? So in our previous presentation, we said degglutination, heart rate, respiration, they are all found where? In the brain stem. To be specific, in the medulla oblongata. That's what we said. Or that's what we said. So here, simply put, since they didn't write medulla oblongata, but they've written brainstem, we can still go in for what? Brainstem. Because brainstem consists of medulla oblongata, the pons, and then the midbrain. Medulla oblongata, the pons, and the midbrain. The midbrain. So basically, we'll go in for that. A patient who has been treated with diazepam on account of neurosis complains of toothache. Doctor administered him an analgesic, but his dose was lower than the average therapeutic dose. That means that they didn't give it the normal dose for this patient. What phenomenon did the doctor take into consideration while prescribing the patient an underdose? And this is called, or this phenomenon, we normally call it what? Potentiating. So to potentiate is to make a drug more effective or active. And don't forget, this patient is already on what? Diazepam. It's already on diazepam. So to potentiate the effectiveness, or to make the drug work better, you don't give the therapeutic dose again. You give a lower dose so that both of them can act together to give you the effect that you are looking for. So in other words, this person was given a low dose of the analgesic so that it will combine with the diazepam. One, it will stop the person from whatever that the person is going through, that the neurosis, and again, it will take care of the toothache. All at the same time. So here we are dealing with what? With potentiating or potentiation. So that will be our answer. And don't also forget that diazepam, they act on gamma action or gamma transmitters. Gamma means it controls, it's an inhibitory kind of effect, or it shows an inhibitory effect. And analgesic also has an inhibitory effect. It also has an inhibitory effect. So if both of them are used, one needs to be low so that you can get the required effect that you are looking for. And that's why, again, you are thinking of what? Potentiating it. So the answer is A. Long-term starvation of a patient resulted in a diminished ratio of albumins and globulins in the plasma. So like we discussed in our previous presentation, when we talked about low albumin level, it means that there will be low oncotic pressure. Low oncotic pressure. However, the question is not about oncotic pressure. The question is about what? Erythrocyte sedimentation rate. Erythrocyte sedimentation rate. And when we say erythrocyte sedimentation rate, we are referring to the rate at which red blood cells will be at the bottom in an hour. So assuming we have our container like this, and we want to look at the erythrocyte sedimentation, that means RBS, or let's say white cells, red blood cells. Assuming this is the sedimentation rate, and assuming this is what? These are our normal plasma volume, or the normal volume in the vessel. But this is the erythrocyte sedimentation rate. So in an hour, we got this value. Do you understand me? So it's all about the ability or the rate at which red blood cells can be sedimented or can sediment in 1 hour. And if there is thickness in the, how do you call it? In the vessel, what it means is that Sedimentation will what? Will increase. That's if the solutions are thick. That means sedimentation will take time before it goes down. It will take time before before the red blood cells will settle. But again, if the solution is very light, what it means that red blood cells can easily settle down. They can easily settle down in the test tube. So in this case, that we are having a diminished albumin and globulin, it means that the thickness of the blood is reduced. And if the thickness of the blood is reduced, what happens? Like I said, it will take time for the how do you call it? The sediment to be sedimented, or to take time for the RBCs to go under the tube, to take time for the blood to go under the tube. So if it will take time for this to go under the tube, it will mean that there will be decreased erythrocyte sedimentation rate. There will be decreased erythrocyte sedimentation rate. Decreased erythrocyte sedimentation rate. So over here, we are looking at what? We're looking at a decreased, but Krok says it's what? Increased. Krok says it is increased. It is increased. It is increased. It is increased. So basically, again, we're having something to argue about. So here, answer is B, but the answer should be A. There will be a decreased erythrocyte sedimentation rate, meaning the time for the erythrocyte to sediment will be decreased, right? Or I'm confusing myself again. Okay, we'll come back to it if there's a confusion. All right. So the answer is what? Is B, but I think the answer should have been A. Decreased erythrocyte sedimentation rate. Decreased erythrocyte sedimentation rate. All right. A patient has a decreased vasopressin. You remember vasopressin? It prevents water from going. That's vasopressin. You're saying that hormone is decreased. That means that water can go more, right? Technically, that's what it means. So it causes polyuria or whole. It means too much urine. And as a result, there's an evidence of what? Dehydration. Good. So what is the mechanism of polyuria development? What is the mechanism for polyuria development? And I said, vasopressin means what? It must prevent water from escaping. Water from escaping. But over here, water is escaping. That means that there is what? A reduced tubular reabsorption of water. Reduced tubular reabsorption of water. So that means that the water are not able to be reabsorbed. So they are get what? Excreted out of the body. So there's a reduced tubular reabsorption of water. So your answer is what? Is E. Your answer is E. Again, reabsorption of water has got nothing to do with what? With sodium nor proteins. When we have to do with vasopressin. When we have to do with what? Vasopressin. So please don't confuse yourself with glucose, with proteins, with ions, whatever. Don't confuse yourself with it. We are mainly referring to what? Water reabsorption. So here it is reduced, so they are excreted. We have to anesthetize the manipulation related to burn surface treatment. Patient was given an intravenous injection, short-acting narcosis. 1 minute that the patient under anesthesia had an increase in blood pressure, increase, tachycardia, increase in tone. Reflexes are remained. After awakening, the patient had disorientation and visual hallucination. So what medication was given? Definitely, we are looking at what? An analgesic. And the analgesic here will be what? Ketamine. And ketamine is used to what? To do anesthesia. However, when it is overdose, it can lead to all of these features that we have. we are having, like agitation, confusion, hallucinations, and so on and so forth. High BP, all of them, you can see them because you are using too much of the what? The ketamine or the analgesic. So your answer is E. A 35-year-old man consulted a dentist about reduced density of the teeth. Reduced density. Then we're talking about bones, isn't it? Reduced density of the teeth. Dental. So we're talking about teeth. Reduced density. Reduced bone. High fragility. That means the bone can easily what? Break during eating solid food. So if you're somebody who can, crack bones, like Yaira who cannot crack bones, that's what happens. Your teeth becomes fragile. So what it means is that what vitamin is deficient? Definitely you are thinking of what? Vitamin D. You are definitely thinking of what? Vitamin D. And vitamin D has to do with what? With calcium. Vitamin D has to do with what? With calcium. Has to do with what? Calcium. If you are joining us for the first time, please do mute your microphone. When presentation is done, you are free to ask all your questions, and we are readily available to help you answer them. So again, there is a deficiency of what? A vitamin, and that vitamin is what? Vitamin D, which is responsible for calcium production. Calcium. All right. We're having a 44 years old. A patient is 44 years old. Lab examination revealed high content of protein. High content of protein. High content of protein. What influence will be exerted on the transcapillary water exchange? Now again, if you're having too much of proteins, what it means is that there will be what? Retention of fluid in the vessel. Isn't it? There will be what? Retention of fluid in the vessel. Because there is too much of what? Of proteins. So what will be the influence? People are being added on to, hold on. Okay, so that's if there's too much of protein, the word retention. However, they said the protein content is 40. Let's kindly mute our microphone. We see, Lord, your microphone is on. Lord, your mic is on. Kindly mute it. Okay, great. So what do we have here? This is for, oh, I can still hear myself. Aha. Great. Thank you. Aha. So what do we have? We are saying the protein content is 40. And if you have higher amount of protein in the vessel, there will be increase in oncotic pressure. That means fluid will not escape. Fluid will be inside the vessel. So there will be what? Hypertension. However, they say that the protein content is 40. And the normal protein content is usually between 60 to 80. The normal protein content is between 60 to 80 grams per liter. 60 to 80 grams per liter, which means that there is low amount of protein inside the vessel. So the oncotic pressure is low. Oncotic pressure is low. And if oncotic pressure is low, that means that fluid will be what? Excreted from. Fluid will definitely be excreted, or fluid will be drawn from the vessel and to go what? Out of the vessel. So that means that there will be what? There will be increased infiltration and a decreased reabsorption. Increased infiltration, meaning that more fluid will go out and less will be reabsorbed. Less will be reabsorbed. Why? Because the protein content is low, it's 40, but the normal protein content is between 60 to 80, 60 to 80 grams per liters. But this is 40. So oncotic pressure is low, so fluid will escape and reabsorption will be reduced. So here we are looking at what? A. A. All right. Great. Guys, we've already done this. After destruction of the CNS structures, an animal lost orientative reflexes. Orientative. So what structure is disturbed? Of course, quadrigeminal plates. Quadrigeminal plates or Colliculi bodies. Colliculi bodies. Great. So your answer is A. No need for further explanation. It's A. Great. An isolated cell of the human heart automatically generate excitement. Again, when we say automatically generate, we are referring to what? SA node, AV node, bundle of His, or Purkinje fibers. Again, we are referring to what? SA node, AV node, bundle of His, and then the Purkinje fibers. These are the cells that are capable of exciting itself automatically or releasing impulses automatically. And we said with with SA node is between 60 to 80. AV node is between what? 59 to 40. Bundle of His is between what? 39 to 20. And less than 20, we are referring to what? The Purkinje. So over here, we're having what? 60 beats per minute. So what comes to mind? Of course, SA node. SA node. SA node. I'm saying it fast because we have already discussed it before. So the answer is what? Is D. Examination of a patient revealed balanced innate type of higher nervous activity according to Pavlov. According to Pavlos, what temperament type does the patient have? So this has to do with what? Temperament. This has to do with what? With temperament. Now, according to Hippocrates' classification of temperament, we can talk about the phlegmatic type of temperament. And with phlegmatic, these people are reasonable, patient, calm, caring, and tolerant. I repeat, phlegmatic people, they are reasonable, patient, calm, caring, and tolerant. So these are for what? Phlegmatic people. Phlegmatic people. Phlegmatic. Now when we say the person is what? Innate or innate. So this person are usually what? Calm. 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 Or not with too much what? Energy, not with too much excitement. So they are what? They are innate people. And they are balanced. So these people are also referring to what? Phlegmatic people. But let's look at the other types. We have choleric. I hope you are writing them. We have choleric type of people. These people are egocentric and extroverts. I repeat, they are egocentric and extrovert. Egocentric and extrovert. They are excitable, impulsive, and restless. Excitable, impulsive, and restless. These are choleric type of people. Then we have sanguine, which basically I fall into it. I'm a sanguine person. So we sanguine people, we are lively, we are sociable, we are carefree, we are talkative, and we are what? Pleasure seeking. Pleasure seeking. If you know me very well, you know that me, I'm very, very lively. I like talking. Like the way I wear hair every day. That's how I am. So if you see a question, the question is describing me, please just go for what? Sanguine. Then we have the melancholic people. Melancholic people, these are very serious people. So they are serious, they are introvert, they are so cautious, and even always suspicious of something. Suspicious of something. So these are the melancholic people. So over here, we are referring to what? To the phlegmatic people. They are calm, reasonable, and what? Caring and tolerant. So these are phlegmatic. Phlegmatic. All right. Examination of a patient revealed overgrowth of facial bones and the soft tissues, tank enlargement. Definitely, you are thinking of what? Growth hormone. So when there's too much increase of the growth hormone, what happens? There will be what? An overgrowth of the facial bones and every other part. So the question now is, what hormone controls it? So growth hormone is also called what? Somatotropin hormone. Somatotropin hormone, or human growth hormone. They all mean the same thing. So here we have what? Hyper secretion of the somatotropin hormones, somatotropic hormones. So your answer is D. 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 All right. A patient has a hemorrhage that is bleeding in the posterior central gyrus. If you can remember, I made mention of the different lobes and what they cause, like the temporal lobe, the occipital lobe, the frontal lobe, the precentral gyrus, the postcentral gyrus. I talk about it, but this is referring to what? The postcentral gyrus. So what type of sensitivity on the opposite side will be disturbed? And with post-central gyrus or posterior central gyrus, this deals with what? Sensory information such as touch. So it deals with touch. It deals with touch. So it is responsible for perception and proprioception. Perception and proprioception sensation. So here we are dealing with what? With skin and proprioceptive. Skin and proprioceptive, because all these things are dealing with what? With touch. They are dealing with touch, sense of touch, sense of touch, sense of touch. So your answer is C. All right. Child asks you to puff up the balloon as much as possible for one exhalation. For one exhalation. So what air volume will you use? What air volume will you use? And over here, you are going to use what we call the vital volume. The vital volume. What then is a vital volume? The vital volume is the total amount of air that is exhaled after maximal inhalation. I repeat, it is the maximum, so the total amount of air that is exhaled after maximal inhalation. So like you breathe in at your maximum level, then you breathe everything out. That is called the vital volume of the lungs. The vital volume of the lungs. The vital volume of the lungs. So here we are looking at for what? For no. This is not inspiratory volume. This is yes. Uh-huh. Yeah. I want to change her BP. Okay. Is she still there? Ah, that woman. One is something. Go give her. Actually, we're supposed to give them this thing. What do you call it? Called adolescent. That one it will just go straight up. But that one you need a nurse who is very good at it. Otherwise, they'll kill the patient for us. So you no, you can give it the same medication, but then like you said, you can give it the laboratory. But who is up there? Forgive. Yeah, I think forgive is good. Yeah, they are all good. They work at the regional hospital. They should know better. Yeah. All right. Okay, guys. So this is not inspirating volume. This is what the vital volume of the lungs. That's what we need. So the answer should be C, not A. Should be what? C, not A. C, not A. C, not A. All right. A 32-year-old patient consulted a doctor about the absence of lactation after parturition. Such disorder might be explained by the deficit of the following what? Hormones. In other words, what is responsible for milk production? The ladies, they know this one better. So you're thinking of what? Prolactin. So your answer is A, prolactin. All right. During influenza epidemic, 40% of the peoples who didn't go in for sports were affected by the disease. So those of you who don't like going for sports, 40 people were affected by the epidemic disease. Now, among the peoples who regularly did physical exercises, this index was 20%. Again, it means that If you like doing exercise, the incidence rate is what? Is low. But those who don't do exercise, incidence rate was what? Was high. However, that's not the question. The question is, what adaptive mechanism determined such a low sickness in people participating in the sports? Again, why is it that people who like sports, the incidence rate is low? And that phenomenon, we call it what? Cross adaptation. Cross adaptation. Cross adaptation. And cross adaptation is simply a temporary loss of sensitivity to a stimulus. To a stimulus, especially an odor or a taste following an exposure to different stimulus. I repeat, it is loss of sensitivity to a stimulus. An example is the odor or a taste following an exposure to a different what? Stimulus. So for instance, those of you who are very good in cooking, okay, in cooking, imagine you are very good in cooking and you're going to taste a food that is not nice. Or let me just say you are used to eating food that is not nice. If you want to get food that is nice, you might even have a problem with that food. Great. So basically, that's what it talks about. After you have been exposed, now because of the exercises these people have been exposed to, their heart or their respiratory system are already used to maybe harsh conditions. Okay. So the disease is not able to affect them as to someone who is not exposed to such physical activity. For the guys, they can attest to this fact that if you are somebody who likes jogging or likes training very well, when you are being called upon to play a football, let's say two small posts, if you've trained before, running up and down, you will not have any problem. But if you have not trained before for a very long time, like somebody I know, call Lord, you are in trouble. The guy will get tired and he will be panting like his heart is being removed from his system. That means he is not exposed to such harsh condition. So this phenomenon, we call it cross adaptation. We call it cross adaptation, cross adaptation, cross adaptation, cross adaptation. So here, your answer is what? Is B, cross adaptation, cross adaptation. All right. A 30-year-old woman was diagnosed with insufficiency of exocrine function of the pancreas, Hydrolysis of what nutrients will be disturbed. What they are trying to ask us is that what hormones with respect to digestion does the pancreas secrete? What hormones does the pancreas secrete? What hormones do they secrete? Don't forget that the hormone contains what we call the exocrine and then the what? The endocrine function. But it's the exocrine function that are involved in digestion. And some of the enzymes that they produce include what? Trypsin. And I remember Yara was asking me about chymotrypsin. Though it can be produced by the duodenum as well, but it's also produced by the pancreas. We also have what? Amylase. We have amylase. And all of these things are involved in digestion of carbohydrates, in digestion of fats and proteins. Carbohydrate, fat, and proteins. So what nutrients will be disturbed? Of course, proteins, fats, and carbohydrates will be disturbed because the enzyme that is produced by the pancreas, the exocrine part of the pancreas, include what? Include trypsin for proteins, amylase for carbohydrate, and lipase for fat. Lipase for fat or lipase for fat. So the answer is A. Short-term physical activity resulted in reflex amplification of heart rate. Like I said earlier on, if you do some exercises that you're not used to, your heart rate begins to beat very high. And as a result, there was a raise in systemic arterial pressure. The question is, what receptor activation was the main cause of the reflex realization or the pressure reflex realization? So these are also called what? The proprioceptors proprioceptors. These are called proprioceptors. Proprioceptors. So the body begins to sense that, oh, this body is moving at a rate that is not used to it. So that's a sense. So you are sensing this vibration in your system running like never before. So everything is stimulated. So it sends impulses to the brain. And then immediately it has also to respond to it. It has to respond to it. It has to respond to it. So we normally call it what? The proprioceptors. Proprioceptors. So these receptors, they give response to change in the position of the body. They give response to change in the position of the body. So as you are moving up and down, your body movement is also changing. It's changing. And sometimes at a pace that the brain cannot even fathom. So basically, we are dealing with proprioceptors. So your answer is A. Great. I love questions on tetanus because they are easy to answer. Again, we have discussed this, so I expect you to get this one time. In the course of an experiment, a skeletal muscle is being stimulated by a series of electrical impulses. What type of muscle relaxation will arise if every subsequent impulse comes in the period of relaxation? Guys, we've done this. In a period of relaxation, and we said we have two types of tetanus. We have the complete and the incomplete. Incomplete, there is no relaxation whatsoever. Incomplete, there is no relaxation whatsoever. And complete is also known as what? Hollow tetanus. Complete is also known as hollow tetanus. Now, in an incomplete, also called wave tetanus, whereby impulses comes in the period of relaxation or a slight relaxation. Impulse will come in. When it's about to relax, an impulse will come in. That is also called what? Partial. So waved, incomplete, or partial tetanus, they all mean the same. So here we are referring to what? To a partial tetanus. We have already discussed it. So please do well to watch the video. They also mean fused and unfused. So please know the differences. Fused means complete. Fused means complete. Fused means complete or hollow tetanus. They all mean the same thing. Okay. The packed cell of a man was 40% before the trauma. What packed cell volume will be observed 24 hours after blood loss of 750 mils? After blood loss of 750 mils. So first of all, blood loss during trauma. Blood loss during trauma always results in loss of all components of the blood, that is including the cells and then the liquid, including the cells and the fluid or the liquid inside. And of course, the packed cell volume is also known as hematocrit. It's also known as what? Hematocrit. So that means that hematocrit will be reduced. Hematocrit will be reduced, or the packed cell volume, which was given at 40, would definitely be reduced. However, when something happens, erythropoiesis will not be able to even replace all the cells that have been lost in 24 hours. Because sometimes when there's blood loss, the body tries to compensate for the loss by increasing production of of blood cells. But within 24 hours, you cannot replace all the volume of blood that has been that has been lost. So therefore, it will definitely not be up to 40%. Definitely not up to 40%. So actually, we are looking at an answer less than 40%. Less than 40%. And over here, we can be looking at for what? For 30%. Because we're looking at the vessel, blood loss, that would be what? Or the packed cell, that would be what? Less than 40%. Less than 40%. So here, our best bet would definitely be what? 30. Our best bet will be 30. All right. A stranger staggers and walks astrandal. He has hypomyotonia of arm and then the leg muscle. Staccato speech. In what brain section is this affection localized? In what? So everything here, staggering. I've told you it deals with what? These are dealing with what? Posture. They are dealing with posture and balance. Posture and balance. Movement. They are all not in the right proportion. And you know that the part of the brain that controls movement and posture or equilibrium, we are talking about what? The cerebellum. 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 So when there's a cerebellar lesion, there will be a disturb in posture, in equilibrium, and in movement. And of course, it can also cause speech disorders. Speech disorders. All right. So here we are looking at cerebellum. Cerebellum. All right. So the answer is D, cerebellum, because patient is staggering. That means can't even stand straight. It's moving haphazardly. All right. I love black group questions because they are always easy to find out, to know the right answer. A pregnant woman had blood group identified. Okay. Reaction of erythrocyte agglutination with standard serum. Blood group O and then blood group B. Groups did not proceed with standard serum of blood group 2. What blood group is under examination? What blood group is under examination? What it means is that when you put blood group O and blood group B, they did not agglutinate with blood group what? So they said they didn't proceed with standard serum. That means that they were agglutination. They were what? Agglutination. So the blood group, wait, what am I saying? A minute. So hold on. What they are saying here is that blood group, let's go back to the diagram that we drew the last time so we don't get ourselves confused. Okay. So we have blood group O, which determines what? I. We have A. We have B. We have what? AB. We have what? AB. Now, blood group O has no what? Antigen. So no what? Antigen. So antigen is not there. No antigen. Blood group A has what? Has antigen what? A. And so therefore it will agglutinate with blood group what? B and blood group O. Okay? It will agglutinate with blood group B and blood group O. And blood group O. It will agglutinate. So you can't give this A to somebody with O and somebody with B. You can never give it because it has what? An antigen present. And again, blood group B, we have what? Antigen to be what? To be B. The antigen to be B. And again, since it has antigen to be B, it will agglutinate with blood group O and blood group A. So you can't give B to somebody who is what? Blood group O or A. You cannot give it because there is what? Antigen present. Antigen is present. Now we have what? AB. AB. We have AB. Now with AB, what it means is that it has what? Both antigen A and antigen what? B. It has antigen A and antigen B. Therefore, it will agglutinate with all the blood groups. It will agglutinate with all the blood groups. That means that you cannot give AB to any of these. You can't give AB to any of these. You can't give AB to any of these. So take note of that. Take note of that. So now, so basically that is what this whole thing all mean. Now they are saying that reaction of erythrocyte agglutination with standard serums of blood group O and blood group B. This one means I. Okay, this is I. This is I. This is what? IV. IV. So first of all, forget about IV because there's nothing about IV in this question. So now we're looking at A, B, C. So what is the blood group of this patient? They are saying that A, sorry, blood group O, okay, and blood group B, that is this, did not do what? Undergo agglutination with blood group what? B. Why am I even getting confused? Please, this beta thing is getting me confused. But actually, this means what? O, B, and then A. O, B, and A. This is blood group O. Blood group B. Blood group B. Then blood group O. These are the blood groups they are what? Or we are what? Referring to. And they're saying these things did not proceed with the standard serum of what? Blood group what? 2. That means that if you put or if you give A to B to O, there's what? Agglutination. And again, if you give A to B, there's what? Agglutination. That means that the blood group that we under observation here is what? Blood group what? A. Is blood group A. Because if you give A to O, there's agglutination. If you give A to B, there will also be what? Agglutination. So over here, we are referring to what? Blood group A, blood group A, blood group A, which also means Roman numeral what? 2. Roman numeral 2. Roman numeral 2. Again, we've solved this question before. Do well to review it again. Do well to review it again. So your answer is E. I think it's the same question. No, it's a different question. This is a different question. Now look at it again. We have blood group of a 30-year-old man was specified before an operation. He has rhesus positive. Okay. And I told you guys that most of the human beings on this planet are all positive, except a handful of them. And if you're a lady, it's very dangerous to some extent because your child can be affected if care is not taken. But now it's no more a cause for alarm because we have the antidote over there. Great. Again, reaction of erythrocyte agglutination was absent. It was what? Absent with standard O. What is it? O, that's under A, I, and I. What it means is that what blood group was under observation. What it means is that when you give O to everybody, there was no agglutination was present. There were no agglutination was present. No agglutination. No wonder blood group O is a universal what? Donor. It's a universal what? Donor. So over here, they are referring to a blood group that when you give to all the blood group types, there will be no agglutination. And that blood group is what? Blood group O. Blood group O. Blood group O. So the answer is what? E. Blood group O. During an experiment, the myotatic reflex has been studied in frogs. After extension in a skeletal muscle, its refractory contraction was absent. The reason for it might be a dysfunction of which receptor? Which receptor? Now, when we talk about myostatic reflex, we are referring to the stretch reflex. The stretch reflex. And this is a muscle contraction in a response to stretching within the muscles. There's a response to stretching within the muscles. So just like Paul will go and do the gym, when you extend your arm and you contract it, these muscles, your bicep and triceps, they are responding to what? To the stretch you are placing on them. The stretch, the load. So there's some kind of a stress on them. They are responding to it. And by that way, they will do their extension and they are what? They are reflexing. So they will reflect and they will extend. So basically, that is what happens when we are dealing with what? With the stretch receptors. With the stretch receptors. And usually, in the stretch receptors, we have what we call the muscle spindle or the spindle muscles. Spindle muscles. Spindle muscles. So these are able to detect the changes in the length of the muscles. The spindle fibers or the spindle muscles, they are able to detect the changes in the length of the muscles. The change in the length of the muscles. It has to do with what? With the spindles or the spindle fibers. The spindle fiber. So when you are gymming, you are stretching the muscles. Stretching it. So by stretching it, the spindle fibers are able to detect that this guy is trying to stretch it. So let's help him to stretch it. Okay. So basically, that's what happens. So here we are referring to what? The muscle spindles or spindle fibers. Spindle fibers. So your answer is B. Is B. A last question on ECG. Look at this. The vagus branch that innervates the heart. And we know that the vagus is a parasympathetic nervous system. When the vagus branch is in play, what will it do? It will cause a slow heartbeat, right? Technically. Now look at this question. They said the vagus branch that innervates the heart are being stimulated in the course of an experiment. As a result of it, the excitement conduction from the atria to the ventricles was brought to a stop. Again, vagus nerve in play. So that means to slow the heartbeat. So if you stimulate it more, it has brought the ventricles to a stop. That means the heart is no more contracting. It is caused by the extrophysial changes in the following structures. In the following structures. So first of all, what sends impulses to the ventricles? What sends impulses to the ventricles? Look at it. As a result of the excitement, conduction from the atrium to the ventricles. So if you have atrium here to the ventricles, what is in between them? Or what impulse is in between them? Or what, how do I call it? What engine is there? And the engine here is what? Is the AV node. So it is the AV node that transfers impulses from the atrium to the ventricles. So when that place is brought to a stop, what it means is that there's a problem with the AV node, the AV node, the AV node, the AV node, the AV node. So here you are dealing with what? AV node or atrioventricular node, atrioventricular node. Again, if you understand the concept of what we are doing, these questions will be bonuses for you guys to solve. There should be bonuses. There should be bonuses. All right. If a man has an attack of bronchospasm, it is necessary to reduce the effect of the vagus on the smooth muscles of the bronchi. What membrane cytoreceptors should be blocked for this purpose? You know, bronchospasm, people in asthma or people who have asthmas, they have this kind of spasms. They have this kind of bronchospasm. So what do? You have to block the receptors for the bronchospasms to be able to relieve the bronchospasm or to relieve the person, So here, what do? You give adenomimetics or bronchodilators. And these are also known as what? The M cholinereceptors. So these are the things that you need to give. These are the things that you need to give. But over here too, they're actually referring to what? The vagus nerve. The vagus nerve. Okay. So the vagus nerve acts on these things to be able to open the bronchioles. But if you take salbutamol is more of less like beta adrenoreceptor, which also will lead to dilation of the bronchioles to make sure that the person can breathe in and breathe out. But the vagus nerve will be functioning more on the cholinereceptors than the adrenoreceptors. So here we are thinking of A rather than D. So the answer is A. We have a man weighs 80 kilograms. After long physical activity, his circulating blood volume has reduced to 5.4 liters. Hematocrit, that is the packed cell volume, is 50%. Whole blood is 80 grams per liter. These blood characteristics are determined first of all by what? So first of all, after a long physical activity, circulating blood volume would decrease due to what? Of course, profuse sweating. When you are doing exercise, you sweat. And as a result, the volume of blood could what? Reduce. Could what? Reduce. Could reduce. And this will produce what we call a relative hyperproteinemia. A relative hyperproteinemia. And what does hyperproteinemia will do? Hyperproteinemia will try to what? To make sure there'll be more sodium. Sorry, the more proteins in the blood, so that it will prevent water from what? Excreting, or to prevent the fluid in the blood to go out. So it will prevent it from what? From going out. So here we are dealing with what? With water loss with sweat. So that was the first mechanism involved in the reduced circulating blood volume. So here we are thinking about what? Water loss through the sweat. Water loss through the sweat. So the answer is B. All right. 16-year-old boy after an illness has diminished function of the protein synthesis. Diminished function of protein synthesis as a result of vitamin K deficiency. Again, vitamin K is involved in what? Of course, coagulation. Vitamin K is involved in coagulation, and it gives what we call carboxylation, or it enhances what we call gamma carboxylation of clotting factors. I've said this over and over like 2 billion times. So please, if not watch the video, do well to have them, watch them, and try to understand them. Okay? However, I'm here. If you have anything, feel free to ask. So here, what disturbance will it be? Of course, blood coagulation. Blood coagulation. All right. In response to change in body position from horizontal to vertical, blood circulation system develops a reflectory pressure reaction. Which of the following is its compulsory component? Its compulsory component. So first of all, from the horizontal, that is lying down position, to a vertical position, quickly will make all the blood volume towards the lower extremity, or it will make, what am I saying? What I'm saying is that it will make all blood volume flow towards the lower extremity, because suddenly you just rose up. So blood will just abruptly flow from the head area towards the lower extremity. And this will reduce venous return. This will reduce venous return. It will reduce venous return. That is blood going into the heart. Blood going into the heart. Instead of going to the heart, they are all coming down because of the sudden rise from the horizontal position to the vertical position. And this phenomenon leads to low cardiac output, which would also lead to low blood supply to the brain, which can cause what? Fainting. Which can cause fainting. Which can cause fainting. So therefore, there is what we call a reflex vasoconstriction. A reflex vasoconstriction in order to increase venous return to the heart in the absence of any pathology. There will be what? A reflex vasoconstriction to increase venous return to the heart. Venous return to the heart. So which of the following is compulsory component? And we are thinking of what? Of vasoconstriction in order to make sure that blood goes back into the heart. Into the heart, or into the heart, basically. Into the heart. So the answer is what? A. Is that A? So normally, if you want to stand up, don't stand up so abruptly like that. And sometimes you realize if you stand up abruptly like that, you feel dizzy at a point. We call it hydrostatic hypotension. Hydrostatic hypotension. Hydrostatic hypotension. That's the phenomenon called hydrostatic hypotension. When abruptly you stood up and then you feel like as if you're going to fall down. All right. Examination of a pregnant woman revealed twice as much as concentration of fibrinogen in the blood plasma. What ESR can this woman have? What ESR can this woman have. Again, I've already explained what erythrocyte sedimentation is. It is the rate at which red blood cells will sediment in a period of 1 hour. In a period of 1 hour. Now look at this. When there is an increase in fibrinogen, there will be a proportional increase in the erythrocyte sedimentation rate. I repeat, when there is an increase in fibrinogen, there will also be what? A proportional increase in ESR. Proportional increase in ESR. And the normal ESR in men is 2 to 10. 2 to 10, that's the normal ESR. 2 to 10. And in women, it is 2 to 15. 2 to 15. 2 to 15. And over here, it has been what? Doubled. It has been what? Doubled. So we are looking at somewhere between what? 40 to 50 millimeters per hour. 40 to 50 millimeters per hour. But of course, the normal weight, weight should be at least up to 30 millimeters. 30. But the closest one should be what? 40 to 50. 40 to 50. So here we are thinking of what? Of D as our answer. D as our answer. D. All right. Introduction of a big dose of histamine to an experimental animal caused abrupt drop of arterial pressure. You know histamine, it causes what? Vasodilation and bronchoconstriction. Vasodilation and bronchoconstriction. So for us to have arterial drop, it means vasodilation was increased. Vasodilation. So here we have what? Vasodilation, also known as dilatation of the resistance vessel. Dilatation of resistance vessel. Again, histamine leads to what? Vasodilation and bronchoconstriction.